Let's continue to get answers on this now. Dr. Jeffrey Burack is an HIV disease specialist with Sutter Health. Doc, thanks for joining us. Being diagnosed with HIV is once considered a death sentence, right? So that's no longer the case, it seems.
It's certainly no longer the case for people who have access to treatment. And fortunately, most people in California do have that access.
And tell us about some of those treatments. We heard a little bit in that story that just aired, but talk about the process that people go through now with treatment and some of the newest advancements that may be helping. Right.
Well, as you heard Jonathan say in the segment before, treatment has come an extraordinarily long way in the 40 years since since AIDS was first reported. And most patients now can be treated with a single pill once a day. So the possibility of treatment several times a year, as was described, that's with injectable treatment. And that treatment is currently available in the United States, but on an every 4-week schedule. So 12 or 13 times a year, although that very same treatment might soon be available every other month, as it was described in the UK. That is an option for some patients. Not all patients are eligible for that treatment because it depends on whether the 2 drugs in that injection would be expected to work for that patient. But the great majority of patients now can be treated with a single pill once a day. The challenge is still taking that pill because it's extremely important that you take every single dose. The HIV virus is very adept at becoming resistant to medications if you miss doses here and there. And that's the great advantage of these injectables, is that it may get people off the hook of having to take medication every single day.
Now, the president has set a goal for the HIV epidemic to be over by 2030. Is that a realistic goal, you think? You think it's going to happen?
I don't think it's going to happen. It's certainly not going to happen worldwide. And I wish I could say it was going to happen here in the United States. We won't be at zero by 2030, but we are making some great progress both in treatment of people who are living with HIV, as we've been talking about, making that treatment not only more effective, more tolerable, safer for the long term, but also easier for people. But it's also important to know that there are great advances in HIV prevention, both traditional methods of prevention by changes in sexual practice or using condoms and the like, but also over the last few years, especially using medications, first pills, and now also the possibility of injections to prevent getting HIV. I think we've still got a long way to go, and the challenge is mostly getting people who are at risk for HIV to recognize that risk and seek the necessary medical help to prevent it. But we're on the road, not by 2030, but we're on the road.
We're on the right track, yeah. All right. We appreciate your time, Doctor. Thanks so much.
My pleasure. Thank you.